Hello there, Miss Jones.
Yes.
Hi there. My name is Kelsey. I'm a medical student working with your physician. Is it all right if I just ask you a few questions?
Absolutely.
All right. Well, it's very nice to meet you.
Nice to meet you.
All right. So what brings you in today?
So I came in because I got my lab results in the mail and I had an abnormal result. I think it says that hemoglobin A1C was 8.5.
Ah, indeed. And that's a bit high.
Yeah.
Okay. So you just kind of want to come in and talk about that.
Yeah, they said I would need to discuss this result with you.
Indeed. Okay. Well, so ideally we want the hemoglobin A1C to be below 6.5.
Okay.
And what this lab tells us is it looks at 3 months of blood sugar control.
Okay.
So this shows us that your blood sugars have been on the high side for the past 3 months.
Okay.
So this means that you very well have diabetes.
Oh, I see.
Which is just kind of glucose, blood sugar, intolerance, or
Okay.
insulin resistance.
Okay.
So what all this means is that, so whenever we eat, that food becomes sugar. And in order for our bodies to actually be able to use that sugar, our pancreas secretes insulin.
Okay.
And that causes the blood sugar to be taken up into the cells out of the blood.
Okay.
Whenever you have diabetes, for whatever reason, your pancreas is not secreting enough insulin to keep up with your blood sugar levels.
Oh. Okay.
And all of that sugar that's left in the blood can cause damage over time to the body.
Okay.
So that's why it's become such a big issue to manage diabetes and to keep it well controlled.
I see.
So some of the risk of diabetes, some of the complications that can result are things like blindness, things like numbness and tingling, loss of sensation in the feet and sometimes the hands, and that can even lead to amputation.
Okay.
And then it can lead to kidney failure, it can lead to heart disease.
Okay.
Yeah, so it can have some very serious complications down the line.
Okay.
Now, you're obviously not at that stage, so we've caught this kind of on the early side, which is good.
Okay.
So we can start kind of monitoring and managing this.
Okay.
All right. And before I kind of get into what all of that is, I wanted to just ask you a couple questions.
Okay.
Have you been having any headaches?
I would say, there have been a couple times after I eat like a heavy dinner and maybe even with dessert, I've noticed a little bit more of a headache.
Okay. All right. Have you noticed any vision changes?
No.
No. Okay. No blurry vision.
No.
Okay. Do you feel like you've been eating more than usual?
I don't think so. Not that I've noticed.
That you noticed? And drinking more than usual, like being really thirsty?
Maybe a little bit more thirsty.
Okay. Urinating more than usual?
Not that I've noticed.
Okay. Any chest pain?
No.
Shortness of breath?
No.
Any nausea or vomiting?
No.
Any bloating sensation?
That's not normal for me.
Okay. But you do have that occasionally?
Yeah, just like occasionally when I eat something that probably wasn't the best.
Okay. Have you noticed any numbness or tingling in your hands or feet?
No. So both my parents have diabetes and they have the numbness and tingling, but I haven't noticed that.
Haven't. Okay. Any weakness?
No.
Have you noticed any sort of skin color changes?
No.
No. Any skin texture changes?
No.
Have you noticed any poor wound healing?
No.
No? Okay. All right. Well, those are good things. So in order to kind of begin managing the diabetes. First off, I want to set you up with a diabetic education class.
Okay.
So in this class, they'll go over exercise and diet, and then also how to use like the glucometer that I'm going to prescribe for you.
Okay.
And then also I'm going to give you a glucometer, which measures your blood sugar levels, and little strips that go with it.
My parents use those.
So I want you to just kind of start checking your blood sugars, and I want you to keep a log of those.
Okay.
And then whenever you come back in, we'll take a look at those logs and see kind of what's going on.
Okay.
And you may want to make a note of like which foods you think are kind of worsening it.
Okay, I can do that.
And then I kind of want to go over just some general kind of lifestyle modifications.
Okay.
So for diet, a low carb and low sugar diet is best. So the more like lean proteins and veggies that you eat, the better.
Okay.
Because those aren't as readily digested into just pure sugar.
Yeah, I think I could definitely eat a little healthier.
Yeah, we all can. Let's see. And then as far as exercise goes, even just doing like some brisk walking, 30 minutes, like maybe 4 times a week might be a good goal if you think you could do that.
Yeah, I don't do anything right now, but I think I could definitely do that.
Well, yep, you just kind of gotta just jump right in and get it started.
Right.
And we can kind of talk a little bit more about exercise goals at the next session.
Okay.
And then I also want you to be very aware of your feet.
Okay.
You may not have any numbness or tingling or loss of sensation right now, but we want to make sure that that isn't worsening, because if it does get worse, then if you like stub your foot or get like a wound, then it can grow and fester and it can become very dangerous very quickly.
Oh, okay.
Because you can't feel it.
Oh, I see. Okay.
Any sort of questions or concerns about anything about this?
I think so right now. I'll go to that class. I remember my dad didn't go to that class, but my mom did, and she said that they helped her, and they had a lot of good information.
All right.
But nothing I can think of right now.
Okay. Well, I'm just going to do a quick physical exam on you. Just listen to your heart. Just going to move your gown down a little bit. Okay. Go listen to your lungs. Big breath in and out through your mouth. Alright, that all sounds very good. I'm just going to check your pulses real quick. Okay, alright, and then alright, very good. And then in addition to the diabetic education class and the glucometer and monitoring your blood sugars, we also may be starting you on a medication called metformin.
Okay.
But I will go and talk to the physician, and then we'll be back in to talk a little bit more about some of this.
Okay.
Is it okay if I come back in with them?
Yeah, absolutely.
All right. Well, it's very nice to meet you.
Nice to meet you.